Good morning. I'm Dan DeRose with 19 News Now, coming to you from our digital desk. It is going to be the topic all day. It is an air quality warning day. It is a first alert day because of what we are seeing outside. You should be able to see the Cleveland skyline in this picture. It looks even worse when we take our Science Center camera here there by the stadium. It looks as if like downtown has a major fire, and that is the smoke. The unfortunate part is it's not from here. It is from Canada. This is continued blowdown smoke from the major wildfires they are having there. We've been keeping our eye on the EPA Air Now, the air quality level. You can see this is for Cleveland, and we are now at 291. We are now just 9 points away from going from very unhealthy to hazardous. That is not something we want to be messing around with, but that is the hand that we have been dealt. We are going to bring in Dr. David Margolius. He is the director of the Cleveland Department of Public Health. Dr. Margolius, how are you today?
I'm okay. This is unprecedented for the city of Cleveland. It's just, it's something else.
And I want you to expand on that. We dealt with this 2 weeks ago. There was a day or two where we kind of smelled campfire smoke. This is way beyond what we saw 2 weeks ago. Put that into perspective for people who are trying to say, isn't this what we were just dealing with?
Yeah, 2 weeks ago, I think our highest level was maybe the 160s, 170s. We're at, as you said, 291 now. I anticipate we'll be above 300 at the next update. For perspective, New York City a few weeks ago, we all saw those pictures that golden haze. They were above 400 at that point. And so we hope we don't get that bad, but this is the worst the air pollution has ever been in the city of Cleveland.
Like ever. I mean, we're talking records that go back a long ways. What are you advising? What do you want people? We've got a big audience here. Is this close the windows? Thankfully, it's not 100 degrees to where, that's maybe not an option. What are you advising as the director of the Board of Public Health?
Yeah, I think you nailed it. So number one, folks should know that this does change hour to hour. So I'm glad that we're live and we're giving, up-to-date information. Airnow.gov is the website that we all use. That's where our information from our teams input into. Number two, when the level is this high, avoid as much as you can going outside. Stay inside with the windows closed.
And we're not talking, when we look at that list, and we've got I believe it goes green, yellow, orange, red, purple, and maroon, or whatever. From time to time in Cleveland, especially in a hot summer, we will see that orange level, and that alert generally goes out just for people who have breathing issues, asthma, COPD, maybe heart issues. This is now everyone. What is the difference? Right. What is the difference when we go from that, oh, this is just for people who have breathing issues? Where are we now?
Yeah, we're just about in the territory, that hazardous level where everyone should be worried, and you can smell it, you can see it, and you can smell it. And so I hope folks at home are recognizing that and doing their best to close the windows and stay inside as much as they can.
We've kind of unfortunately gotten used to wearing masks. Let's talk about if you have to be outside, whether you're a worker or you have to take the dog for a walk. Should we be wearing masks, and specifically what kind of masks will work and won't work?
Yeah, my recommendation is really focused on limiting outdoor activities as much as possible. Treat it like a bad weather day. So if you have outdoor work, find indoor work, with your crews. And the reason I'm not going to emphasize masking is because the masks that would work in this case would be those perfectly fit N95s that are pristine, brand new. And I worry that most people are going to bring out their old cloth masks and surgical masks or old N95s that will only give them a false sense of security.
Well, that's a very good point. So you're saying mask or no mask, you would prefer people just not go outside, period. That's your recommendation.
That's right. Yeah, my worry is that folks will bring out masks that aren't doing the work and spend more time outside than they need to, and that would be worse for their health.
Can you give us some warning signs? What tells me I've had too much exposure? What tells me I need to put down my shovel, my work, whatever, my lawnmower? What are the warning signs that should say I need to get somewhere where there's better air?
So number one, if you have a history of any kind of lung problems, then you need to get inside, especially. Number two, if you're noticing that it's harder to breathe, if you're coughing more, you're having a hard time kind of taking a deep breath. I mean, those are all warning signs for folks to just get inside to clean air.
Excellent advice, Dr. Margolius. We always like to leave our guests with the final word here. You used the word unprecedented earlier. You get the final word here on what you want people in the Cleveland area to know.
Folks, this is from Canadian Wildfires right now. It's going to change hour to hour. So stay tuned to your local media or to airnow.gov or both. And we'll keep getting the word out on at the moment, staying inside and staying safe.
Very good advice, Dr. Margolius. He is the director of the Cleveland Board of Public Health. We certainly appreciate the time, and I know you're busy. Thank you, Dr. Margolius.
My pleasure. Thanks so much, Dan. Appreciate it.
All right, take care. Again, it is an issue. We wanted you to hear from the experts. This is happening now. As Dr. Margolius just said, it's going to change hour by hour. Just look at downtown. We couldn't see buildings a minute ago, 10 minutes ago, hour ago. You can kind of make out some outlines, but that doesn't mean it's gotten better. Take a look at our shot from the Great Lakes Science Center camera. It looks as if this fire is in our backyard, as if this fire was just down the street from downtown. That's not the case, and that shows you just how much smoke is in the air. We're going to look one last time at our air quality level. Again, we are at 291 right now. I'm going to refresh this just because we're live. Still at 291. We get updates to this a couple of times an hour, specifically at the top of every hour. I think we also get one at the bottom of every hour. So we'll continue to watch this as this develops. Again, you heard it from the experts. Whether or not you have breathing issues, you should not be outside today. Dr. Margolius said treat today as a bad weather day and stay inside. Close your windows and just protect yourself. We're going to keep on this. We're going to keep watching this and making sure you're aware of any changes. If we get above that 300 threshold that puts us into the hazard category, we will make sure we come back on here and get you the latest information. Remember, we have our 11 o'clock news coming up on CW43 and our noon news on Channel 19. Until then, I'm Dan DeRose with 19 News. Stay safe.
19 News is everywhere. Download our CTV apps and